Good day to all our colleagues and leaders all over the globe. Today is Mother's Day, and as safety professionals, we need to bring in the best amongst the best, our great leader, our mother, the Amazon of safety, not only in Nigeria, but the Amazon of safety in this world. Nobody bears that name. Audience, you are meeting the Amazon of safety today. Then who is that Amazon of safety? No other person other than Ms. Fayo Williams, a co-founder of Simply Exponential Consult Limited, and of course, co-founder and executive director of Relight Supply. For Simply Exponential Consult Limited, the Amazon is the founder. That is where we say we are meeting the Amazon, our mother today. In Nigeria today and across Africa, when you talk of the mother with that sympathy, with that empathy, with that passion for saving lives, is our teacher. She is my teacher, she is my mentor with respect to saving of lives. She's going to go through a lot of things with us today within the next few minutes. Remember, she's a certified safety journalist, 100% certified. But today, I'm also going to ask her questions the way she has been asking all of us questions in Nigeria. Permit me to welcome here today Mrs. the Amazon of Safety, Madam Fayo Williams. You are welcome, Madam.
Thank you very much, Engineer Jamiu. It's good to be here.
Thank you so much. You can see the voice. Thank you very much. That's the voice of our mother. This is the type of voice that when you have a first aid case issues, when they just talk alone, you open your eyes and you are okay. Thank you, Madam. Today,
welcome.
We'll be going through behavioral-based safety. We know in the world today, as health and safety professionals, behavioral safety is very, very important. But now, we are going to match it up with COVID-19 experience from our mother, and that is behavioral-based safety, a tool for COVID-19 containment. How do you contain COVID-19 with behavioral safety programs? And I have the best person to give this presentation podcast today, the Safety Advocacy Podcast 001, bringing our mother to be the first speaker on Mother's Day. Ms. Fayo Williams, please fire on and move on, please, ma. Thank you.
Thank you very much. So the topic again is behavioral-based safety, a tool for COVID-19 containment. And the first question you ask yourself is, what is behavioral safety? In simple terms, behavior is what a person does or says. In occupational safety and health, behavioral safety is the application of behavioral research on human performance to solve the problems of safety in the workplace. Behavior drives the way people think and act. For example, before the advent of COVID, we socialized freely, we did not need the nose mask, sanitizers were not popular, but with the advent of COVID, it took time to change the mindsets of people to actually protect themselves. And there's this widely held belief, particularly in the local circles in my own part of the world here, that something must kill a man. So many employees threw caution to the wind. A behavioral safety program aims to improve an organization's safety culture, that is the overall safety culture, by changing the behavior of workers. It is also called behavioral modification or behavior-based safety. It focuses on fostering safe behavior among workers or individuals by exploring the motives or the root cause for either unsafe or safe behavioral patterns. When implemented correctly, a BBS, which is behavior-based safety program, can provide commendable rewards, help to change unsafe behavior, reduce the incidence of accidents, improve workplace morale, and reduce the spread of COVID-19. It involves collective participation from management and the employees, which promotes that good overall safety culture. And it needs to go beyond the workplace. Although it is aimed at induced behavioral change, I dare say it's not a substitute for risk minimization and elimination. Risk assessment and the necessary mitigants, putting in place controls is very, very key in all we do in the health and safety profession. So why is it important? Why do we have to talk about behavior-based safety? A researcher once asked, why behavioral safety when we have the best equipment available, when we have all the systems and procedures in place, when all our workforce are properly trained? Well, the best equipment will not help if people do not use it properly. The best PPE cannot keep people safe if the human being is not convinced to behave in the right way. Everyone is responsible for their health and safety. Hence, modification in behavior helps to drive that conscious safety mindset. Again, we need to emphasize that behavioral safety now needs to go beyond the workplace. We are not talking about the four walls of an organization. Even on the street, in their homes, behavioral-based safety needs to be concerned about those areas. In COVID-19 times, we are being enjoined to use a face mask, to effect social distancing, increased personal hygiene, several hand washings, good observational and reporting skills, compliance with isolation, contact tracing, event attendance, occupancy, and other safety procedures are key. A big lesson on behavioral safety is that people actually know what to do 95% of the time, but sometimes they don't do it or they are afraid to do it. For example, an employee who comes down with COVID-19 symptoms may fear that stopping the job may upset the boss because of time constraints on a project, upset their mates, or give the impression that they are not strong enough to cope. Traditional BBS training, which is the behavioral-based training, may fail to take into consideration factors such as culture, as gender, where people say, oh, you are not man enough, societal and environmental norms, or preconceived ideas. Right now, we have some resistance to the issue of vaccination. That is going on now within our sphere of the world. All these factors may influence employee behavior, and some people may require more coaching on the subject, a bit more experience, or they may need to be trained on the consequence of lack of compliance, on the consequence of loss of concentration, or even how to overcome problems at home in order for their behavior to be in sync with the organization's safety culture. BBS is essential for fostering that positive safety culture. So what is a positive safety culture? Organizations with a positive safety culture are characterized by good communications founded on mutual trust, shared perception, and the importance of safety, by the efficacy of their preventive measures. So let's look at what influences human behavior. Many a times, it's just that natural instinct.
Exactly.
Learned behavior. I've been doing it for donkey years. Social norms, desire for rewards. External influences also affect human behavior. The spread of COVID-19 can occur by inappropriate behavior. And as mentioned before, behaviors and actions influence culture through these attitudes and perceptions. Behaviors also determine the performance of a system, because every system will at some point be implemented by human beings. Individuals must consciously change their behavior and change their attitude and beliefs to fit the new normal occasioned by COVID-19 and other environmental conditions. We live in an era where false information travels fast and could influence unsafe behavior. Some individuals in this part of the world still believe that there is no COVID-19 and they see no need to protect themselves. There is a grossly inadequate level of infrastructural support for adhering to desired behavior, and in some cases, there is a lack of regulation. However, we preach that employees should be self-regulating. That would be better in order to achieve a good safety culture. So what are the key features of using behavioral-based safety as a tool for COVID-19 containment? We have to define what is safe and unsafe in terms of behavior. All staff should be involved in observation of behavior in the workplace with or without targets. They must be able to provide feedback and re-educate on safe behavior. We must learn to think about various aspects of the human factor as previously mentioned. Behavioral-based safety programs should be owned by everybody. Trust levels amongst management and employees must match. There must be a sync. At the country level, we saw some world leaders shunning the use of PPE in a pandemic with predictable results, as we all saw. So what influences human behavior? Again, we would say organizational values, the safety culture, management commitment. These are things that all influence the human behavior in the environment or in an organization. Behavioral modification as a tool for COVID-19. This is our prescription today. It involves psychological guidance because according to behavioral science and disease prevention, psychology is a fundamental way to minimize COVID-19 spread as it helps to change behaviors and predict people's responses to changes in the workplace or government policy. As we await vaccination, it's very important that we modify our behaviors to deal with the new normal. Management teams can help drive behavioral modifications by listening to employees' concerns and acting on them, actively engaging the workforce in decision-making and minimizing COVID-19 in the workplace. They must create an unbreakable emotional bond with their workers. During this time, employees may become stressed. There are a lot of mental health issues as they constantly adjust to the new way of doing things, working from home, combining domestic and office chores. The organization can provide contact advice on stress management, anxiety, and then mental well-being. These are key. Punishing employees for behaving unsafely is never the answer. Using this approach just engenders fear and eventually ignoring that particular aspect of safe behavior. We need to put in a system of praise or reward. Again, we need to introduce a system of praise or reward for individuals who come up with initiatives for containing COVID-19 or who exhibit safe behavior that can help drive change. For instance, we could have safety champions in each department. Research has linked positive change in behavior to reduction of unsafe behavior across diverse industries. Management influence. This cannot be overlooked. Managers must act as leaders and facilitators, encouraging suggestions, motivating staff, not only on health and safety issues, but any issues which can promote team culture. As we round up, I'll give some advice to organizations considering these behavioral-based approaches. Some of the do's are that, number one, use it as a means of dialogue. Secondly, make sure that participants focus on root causes of the behavior. What are the underlying factors giving rise to these behaviors? And then the don'ts include not underestimating the effort and planning it requires. You may need to put up signages all over the organization and let people know the consequences of behavior lapses. Don't be over optimistic and don't get carried away. To increase effectiveness and chances of success, there must be ownership, commitment. The approach should be seen as fair and just. It must engender trust. Managers must act as role models, and the employees should be sufficiently convinced of the benefits of behavioral-based safety to take it into the society and help contain COVID-19. Thank you.
Wow. The whole world, you can see when we call Mrs. Fayo Williams the Amazon of safety, we are not wrong. And if there's other names, other titles we can give to her, then you think she worth it. That is why if I've introduced Madam Fayo Williams, that would have been the whole lecture today. Thank you so much for this wonderful presentation. We appreciate you. But we gain a lot of things from your presentation. I see that you are getting a lot of things, and I'm happy that I'm moderating for today. If not, I would have regretted if I'm not the one moderating. I'm hearing this from the podcast. Thank you so much, ma. And you mentioned to us, audience, that look, if you check the mirror, anytime you look at the mirror, whoever you see at the mirror is responsible for your safety. So you are going to see yourself anyway. So you are responsible. Why the management is accountable. So you have to take ownership of whatever you do. She said it, you must take ownership. And that is in line with ISO 45001 2018 clause 5.1. Is there leadership and commitment? Then clause 5.4 talks about participation and consultation. That you must consult your workers. They must have the trust in you as leaders. It's when I have trust in you as leaders that I'll be ready to do whatever you ask me to do. Openness is very important. Transparency. Madam, you see, I was just jotting down. I think I can write a book on this now. Behavioral safety, a tool for COVID-19 containment.
You're welcome.
Thank you so much, madam. While we are having the podcast, some questions came in through some of our colleagues and they sent to me. And you please just give us very few minutes so we just go through the question. I must say today for our audience, Madam Fayo Williams just traveled to the state just now and she came into this podcast. The Safety Advocacy podcast. Madam came in all the way from travel, and that shows high level of passion, high level of commitment, high level of love for humanity. Thank you so much, madam. The first question is this. They said, behavioral-based safety programs, which you have just taught us, you mentioned, should be a way to reduce accidents in the organizations. Yes. Some companies have started doing it, yet we still see accidents all over happening in various organizations. Could you please tell us one or two things we can also do and add more to prevent such accidents? Thank you.
Thank you very much. Apart from the behavioral-based safety programs, we need to supervise effectively. You see, people do what you inspect, not what you expect.
Wow.
Particularly when you have a team of workers who have been on the job for a long time. There's this complacency. There's this donkey years of doing it mentality.
I know it all.
I know it all. Therefore, you will not use a fall arrestor, you will not use a harness. And eventually, some carelessness like this could lead to fatalities. So also once in a while, the management should show the consequence of lack of behavior-based safety, because this equipment are being provided, but it's the human being who refuses to go ahead and use and do things with the right procedure, with the right mindset, following the right guidelines. So effective supervision is key. Showing the consequence of bad practice, consequence management, and having case studies, having discussion, toolbox talk that really emphasizes on the costs of these lapses, both to the employee and to the organization.
In short, lesson from incidents.
Something very yes, definitely.
Thank you so much, madam. The safety podcast is coming up, and then we have to say this is the first one 001 on the Mother's Day, and we are bringing the Amazon of safety. Amazon, let me give one more question for you.
Okay.
Just one more question.
No problem.
Now we've talked about COVID-19. We've talked about behavioral-based safety program. How do you think the entire world can use behavioral safety program or strategies to manage COVID-19, to contain COVID-19?
Thank you very much. I think that this is already happening actually, because we have the leadership in this country. For instance, the governor in my own state here is the incident commander.
The governor of Lagos State.
The governor of Lagos State
Governor.
is the incident commander for the state. He has taken that leadership role. He has made sure that he rolls out communication.
Good.
I've participated in many through Echo FM and some other media.
Fantastic.
A lot of this communication is also displayed, like visual, the audio, and various. It has trickled down to various religious centers and so on and so forth. So you have the incident commander at the head, serving as like the CEO or manager. Fantastic. And they have a team. We have the COVID-19 team, the response team in Lagos State, and they also are carrying out the orders of the incident commander. And
Fantastic.
They keep on researching what's going on in the world. When we had another strain of COVID-19, this was also communicated to the populace that, this variant is even more virulent than the earlier ones. Yeah. So all over the world, we need to see leadership in action. And once that is in place, the actions of the leadership, the speeches and the information passed by the leaders will be better understood and better implemented by the followership. So this is how we can take behavior-based safety using the leaders as a role model and as an example to the followers all over the world.
Wow, thank you so much. That brings me to refer us to Jacinda, the Prime Minister of New Zealand. Woman.
Yes, she's doing so well.
Angela Merkel of Germany.
That's
woman.
Right.
The Prime Minister in Taiwan. Women.
That's
Women
right.
are doing great in the containment of COVID-19. So I don't expect anything less from you, madam. It's like women have it as part of them. You care for us.
Passion.
You take care of us. It's your passion.
That's
and
right.
We appreciate the Governor of Lagos, Mr. Abajide
Sanwo-Olu,
making himself the incident commander.
That's right.
To entrust and enhance leadership and commitment in line with our standard, and that is good. And we also appreciate the Lagos State Safety Commission being on the field to ensure enforcement,
to regulate
and compliance, and that's very good.
That's right.
Madam Fayo Williams, the Amazon of safety. I don't know how to clap, but let me just do this for you. Thank you very much. Thank you very much.
Thank you for having me.
Thank you.
Have a beautiful day.
Thank you. Thank you.